dashboard on our we have a data dashboard on our website, which will help you chart out like what is the variance across facility types, across those four positions, and across regional breakdowns. This right now you can see just again, these are the same data that I shared a moment ago, but you can see how it varies across the state. And then on the bottom here, you can see how it varies across kind of the five big buckets of facility types that we broke the data down into. So that's available on the website, can share that. Like I said, we're working to guide alignment between these policy efforts, and then marry that up with, or match that up with what we're seeing in the regions. It's difficult work. It's gonna, it is an ongoing basis. Ultimately, we're working to advance priorities through regional action while making, having a clear view of how that can only get us so far. And ultimately, there are policy interventions that are needed to address more systemic challenges. And there are certainly many systemic challenges. And ultimately, what's important about the center's work and why I'm so appreciative of partnerships like with the Coalition on Aging and many of the other organizations that are on the call today is that we need to build this persistent coordinated infrastructure. This work to have a long-term lens on where we need to go and really clearly define where we are in relation to that, so we understand the pathway to get there, is critical. And so our ability to keep moving on that course, while recognizing the need for really durable infrastructure to support that, there are a lot of urgent needs. This is one of those like important versus urgent things, I think. So that is, as you are thinking about needs in the space, this is one of those structural things that right now the center, we have some seed funding, we have grant funding to support this work. We are working to figure out what is the sustainable path for this, because this can't just be like grant cycle to grant cycle kind of stuff. This is, North Carolina needs this over the course of decades, and so we're figuring out the pathway to get there, but want to make sure you're aware of that need and opportunity as well. And then finally, with your specific efforts, thinking about advocacy and resources that are out there, we have a resource hub that's on our website. It's broken down into 3 sections. One is a data hub, which there's no new data there. What it really is kind of like your gateway to kind of the most used and relevant data sources that are out there, and helps users understand how do you make best use of NC NERSCast as opposed to using NC Commerce's labor projections. How do you use HPDS from SHEPS? How do you use our Health Town Alliance data? So there's information there on that. We have a policy and research hub, which frankly, if I'm being honest, I think this is where we need to do the most work in the coming months, but we are working to pull together the most relevant research related to health workforce and have it all in one place. So you have to rely less on Google and just go to the one place, and there's kind of a one-stop shop for that information. And then we are also developing the solutions playbook, which helps map out both a process, a decision-making framework, and ultimately compiles a list of best practices, templates, toolkits, and stuff that informs like, what can we start working on today based on what we have already learned as a state previously. So that lives on the website as well, and is available for your access. And so that's what I had prepped for you. I will see what the links were. Trish, thank you for helping with that. Okay, you're super on top of it, so you got all of it. So thank you all for the time. Happy to answer questions, but I think I'm right up at time anyway. Thanks, Mary.
Thank you, Andy. Great overview. Appreciate that. Just so everybody knows, our recommendation or our priority list for our legislative priorities in this regard is, we say, help stabilize the healthcare workforce crisis by building on existing initiatives already ongoing in the state, and Andy's talked about these, and by expanding financial incentives such as loan repayment programs, tuition reimbursement, and stipends to attract and retain healthcare workers. So a lot of what we will do in this area is going to be working in collaboration with the others that are taking the leads on this. I know that many of you in the healthcare arena are going to be putting forth budget appropriation requests. You're going to be doing things that might deal with policy, things of that nature. So as coalition, certainly want to be supportive of what's going on. And we want to be supportive of the things that the center is doing. The center's not going to have a legislative agenda as such, but they're a great source of information. Andy has told you about the resource hub they have. If you're talking with legislators and want data and statistics and things like that, I'm sure that resource hub has those types of information. Also, when it comes to addressing the workforce crisis, that we've got this direct care workforce initiative that Trish is going to talk to you about a little bit later. But, this is an area that we will be active in, and we will monitor what's going on and try to do what we can to support things that look like they may be doable this legislative session in that regard. So Andy, thank you again. We might have time for one or two questions. Anybody have a question for Andy? I'm not seeing any. So Andy, thank you. We will make your slides available. We'll put them online, post them on our website so people will have those. We'll also send them out to folks after the meeting too. But we appreciate all you're doing and certainly appreciate the collaborative relationship we have with between the coalition and the center at this point. So thank you much. All righty. So our second issue we're going to talk about is state facilitated, privately operated retirement savings program, better known as Work and Save. And DeMarcus Andrews with AARP, he's Associate State Director for Advocacy with AARP. He's going to talk to us about this. And DeMarcus, I know many people on here probably have known you from when you were with another organization, the Center for Responsible Lending. So you've been at AARP 4 or 5 months now, I think. So we're glad to see you in this new role and excited that you're with us today to talk about Work and Save.
Thank you, Mary. And yes, I've been joining these meetings since 2020 during my time at the Center for Responsible Lending. And it's actually where I made the connection with Heather Burkhart, who was running the coalition at the time, who helped me get the job at AARP. So the coalition has always been good to me. So I appreciate it. But let me see if I can share my screen.
Yeah. There you go. We got you.
Okay. All right. So I'm sure you all don't want to see that.
So while you're doing that, let me just mention the wording for our legislative agenda. We say, establish a state facilitated, privately operated retirement savings program for those who do not have a savings option to encourage more state residents to save for retirement. So that's the wording on our legislative agenda.
That is perfectly said, Mary. Thank you. So again, everyone, my name is DeMarcus Andrews. I am the Associate State Director of Advocacy at AARP in our North Carolina office. I've been here for about 8 or 9 months now. As you can imagine, it's a huge organization, so I'm still learning. But it's been a joy to join the team here in North Carolina. But again, I wanted to thank the coalition for placing this legislation as one of the priorities for the coming session. I think we're poised to really make some movement on this issue this session. So really appreciate the support. So again, I am here to talk about the North Carolina Work and Save legislation, which is a proposed benefit for small businesses in our state. So let me minimize this a bit. Okay. So what is North Carolina Work and Save? So this legislation is basically to establish a public-private partnership that provides a no-cost kind of retirement solution for small businesses. And I will say this kind of was birthed out of a need for small businesses to provide a retirement savings plan for their employees that was at inexpensive or at no cost at all, in which this legislation will create a no cost kind of plug and play initiative for small businesses. And I will say this legislation particularly, there is about 1.8, and I think the number has climbed a bit, of millions of North Carolinians that don't have a pathway to save for retirement through their employer. So this allows for them to have, deductible, small pay that comes out of their paycheck on a regular basis. And, this particular fact isn't mentioned on the screen, but it is mentioned in the fact sheet that I shared with Mary that was sent out kind of before the meeting. But Americans are 15 times more likely to save for retirement when they can do so through their employer. And I think that kind of number really illustrates how important saving for retirement is, and how likely folks are to do it if they're allowed to do it through their employer. And another thing I'll mention about this legislation is that, which is a really important kind of talking point when we're talking down at the General Assembly, is that there's no ongoing cost for North Carolina to initiate this plan. And so there are upfront costs, and we've estimated that to be around $1 million. But we've seen in other states, they've set up a loan program in which the state is allowed to recoup that money, through the cost of the initial program. And so this kind of pays for itself over time. So it's really a great benefit for the state and also for small businesses. This is kind of just a snapshot of some of the states around our country who have implemented Work and Save. This isn't a up-to-date kind of a capture. We are working on getting an updated fact sheet for folks, but there are about 2 or 3 additional states that have implemented Work and Save since this illustration has been created. But as you can see, there's a movement around our country, and there's a need for folks to be able to, save for retirement through their employer. This is just another kind of snapshot for data around our country of states who've implemented Work and Save legislation. So you have about $1 billion plus in assets that folks have invested into their retirement plans. You have a 5% monthly contribution that folks are making. And another big kind of point is 2 out of 3 who enroll in the retirement savings plans stay in those plans. And so the really, I think, beneficial kind of initiative that's been illustrated all around our country. So one thing that I wanted to do is also just give you a little background from this past session about kind of where things have gone, where things stand, and then we'll move into kind of our work for the upcoming long session. So as you see pictured here is Representative Lowry, who's our primary bill sponsor and will be our primary bill sponsor moving into the long session this year. And there were a couple of kind of challenges that we had early on in the process. And so one being where to house the Work and Save legislation. So initially, we had planned for the Work and Save initiative to be housed in the College Foundation up under their purview. But as things kind of moved along, they were inundated with opportunity scholarships and just didn't really have the capacity to really kind of oversee this initiative. And so one thing that we did is we looked in other states, because I think one of the beneficial things about legislation is that you really don't have to reinvent the wheel. So we looked at other states and found that the Treasury Department was where most of these initiatives were housed around the country. And so we worked on trying to get the support of the current treasurer. But as you can imagine, he was a bit hesitant, especially knowing we had an upcoming election and that he wouldn't be the individual overseeing the particular project. And so we kind of transitioned our focus into the treasury race. And the candidates were the current treasurer now, which is Republican Brad Briner, and the Democratic candidate at the time was Wesley Harris. So we had gotten support from both, and even post-election have met with Brad Briner, have his support for housing the initiative there. And so that was a huge win for this legislation, because it was something we really didn't, or were really hesitant about moving, with not knowing where this particular legislation will be housed. So that was another challenge that we were able to work through. But as you can imagine, as you get later into the session, at least in the short session, a lot of the air in the room was being sucked up by the additional $1 billion the state was expecting in tax revenue. And so really trying to figure out how to disperse those funds throughout the state. And so many other issues just kind of didn't move at all. But I will say that in our discussions with Representative Lowry moving into the long session, there was a lot of support for the legislation, many folks wanting to be more involved. And even post-election, I've reached out to the 140 plus returning folks in the House and in the Senate, and many of them have replied just asking if we're planning to move the legislation this year. And so I really think we're poised for going into the new year or the new session with some possibilities of actually moving this legislation through the House. So I wanted to just kind of give you a little insights in kind of some of our plans for the Work and Save legislation. So potentially, I know my manager, Chris, who oversees the state advocacy work, is working with Lowry to figure out which day, the 11th or 12th, on when this bill will be introduced. We wanted to work really hard on getting this bill introduced early, because this is also a budget year. And there's just a lot of issues that will start to kind of suck up the air in the room as we move through the session. So we wanted to make sure that if we can get this thing introduced early, there's some possibilities that we can really move it. So that is the hope there. We are planning a lobby day on the 12th to gather co-sponsors for North Carolina Work and Save. And we have other ways for folks to kind of be involved that day through phones, by emails. We're happy to send out templates for folks to use and reaching out to their district reps, asking them to support the North Carolina Work and Save legislation. And I think another way to be involved, if you're connected to small businesses, we would certainly love to talk to them. I think having word of mouth from small business owners about the need, for their employees to be able to save for retirement, and also just talking about the impact that this could have on their small businesses. So that is it from me. I'm happy to take any questions about the North Carolina Work and Save legislation. Definitely feel free to reach out to me if you have any additional questions about the bill. If you have any questions about our priorities, our other priorities moving into the year, certainly feel free to reach out to me. But yeah, I really appreciate your time today.
Well, Marcus, let me just make sure I understood correctly. What you're saying is that this would be at no cost to the employer and no cost to the individual that would be enrolled in this, but there would be a 1 million upfront administrative cost of getting this up and running. So there would be a need for a $1 million appropriation or thereabouts. Is that correct?
That's right. It could be an appropriation, but it can also be, which we've seen in other states, is a loan that's set up that is allowed to be paid back over time. So I think there's many different ways that they can kind of set up the program, and we're still working through what that initial kind of setup would be. But yeah, there are a few different options for the state to kind of recoup that $1 million in initial cost for the program.
Okay. And I think one thing that certainly we all have are aware of is that people aren't saving this day and time like they used to.
That's right.
And we particularly are concerned about the fact that you've got folks that might have healthcare needs down the track or long-term care needs. And if they don't have any little nest egg they've saved for, then their options for care, may be determined by that too. So,
Yep,
so
that's
it
very
has
right.
lots of ramifications, not only for current time, but also for the future as people age too. So
Yeah,
Gloria, I
and
see, yeah,
oh, no, but I was just
Gloria,
going to mention,
yeah,
that,
yeah.
we know based off of research that there are a lot of folks that are in retirement that are super dependent on Social Security. And so providing other, folks avenues to be able to save, through their employer is definitely something that's beneficial in retirement.
Gloria, I see your hand up, and introduce yourself. People may not know who you are.
Sure, thank you. Hi, everyone. I am Gloria Garton. I'm with the North Carolina Statewide Independent Living Council, and I work closely with the Centers for Independent Living here in North Carolina. And obviously, we want people to be independent in their own homes, regardless of their age. But my question to you is, would this initiative include nonprofits? I know the North Carolina Nonprofit Association has created a retirement option. However, it still requires a certain number of employees within the nonprofit. So let's say, even like the Coalition on Aging and the North Carolina Silk, we're not going to probably get beyond 2 employees, but I have no retirement options to offer. And I know there's many nonprofits out there that are in the same situation. So would this include nonprofits or?
That is a great question, Gloria, and I'm unsure about that, the answer to that question, but it's certainly something I can take back to my manager and find that out. I certainly know that it would be a benefit. I know I worked for a small nonprofit early in my career, Toxic Free, which I'm on the board for now. That we didn't offer a retirement savings plan, and I had to go outside of that to get an IRA. Which was really hard to find because it wasn't connected to my paycheck. So I can certainly understand the benefits of it being in the nonprofit space. So I'll get back to you on that question, Gloria. If you want to drop your email in the chat, I'll certainly reach out to you directly.
Well, thank you. And I think it would be interesting. I'm sure maybe the data already exists out there, but I'm guessing there's a larger majority of individuals that are aging or have disabilities that are in the nonprofit workforce as opposed to the regular workforce. I may be wrong. But when I think about the field that I'm in with promoting, I'm providing great opportunities for people with disabilities to work. It's oftentimes nonprofits that are hiring these individuals. So I think that would be another interesting angle to look at.
Thank you, Gloria, for that
A great point.
question. Let's see, Jill, I see Jill Zimmerman Lawrence. I see you had a question about recouping the money for the startup. Did he answer your question? Do you have anything else on that?
I may have missed the response. I know, DeMarcus, you said something about a loan with a repayment. I guess I assumed that there would be a fee to enter into it, and that was the repayment process, but I'm hearing that's not the case.
Well, yeah, like I said, there's a few different options, Jill, that we've seen in other states that have been done, and one has been through a loan program where they've been able to recoup their money over time. We know ultimately there's a savings through the state by less folks just kind of being dependent on government assistance programs like Medicaid, or just fewer people kind of facing financial insecurity as they age. But yes, there are multiple ways that I think the state can recoup the $1 million if there's a loan program that is set up for it.
Thanks so much.
Yeah, you're welcome.
There's a couple of comments in the chat relative to nonprofits. I'll let you guys look at. Any other questions from anybody on this?
I have a quick question. Sorry, I can't find the hand raising.
Okay, go ahead, Tara.
Thank you. Hi, DeMarcus. Thank you for
Hey,
that.
Tara.
I'm Tara Muller with Disability Rights. This is great to hear. I'm wondering if there's been any consideration about benefits counseling for people who, a big problem that we run into a lot is that people with disabilities are concerned about having money and how that may impact their entitlement to things like Social Security benefits, Social Security disability, other types of government benefits. And I know that there are ways to have, lumps of money and protect it so that it doesn't endanger that. So I just wondered if that was a consideration, and if you've run into any of those issues.
Yeah, so not in my experience with the legislation that we've run into someone having this benefit and also losing benefits from Social Security or any other type of government assistance programs. But I can definitely clarify with Chris and with our lobbyists about if there is any considerations that folks may lose some of their benefits if this is something that is implemented through the state.
I actually know this is, I was actually saw an article the other day that this has come up in some other states, and that states are beginning to address this because it seems the states that have adopted this really are behind it a lot and want people to save. But at the same time, there is that concern that you need to think about how this might have unintended consequences on things. So thanks to Marcus. That would be great if y'all could check on that.
Yeah,
Dick, I see
certainly.
your hand up.
Yes, hi. Hi, DeMarcus. Thanks so
Hey,
much.
Dick.
I'm really glad to see that initiative because I know it's been done in other states, and the lack of savings is one part of the three-legged stool that so many retirees have lost. I wonder what's been the experience in other states about who uses this, how much do they save, and this particular question about fees. That's one of the big failings with all these 401ks and things that in some cases they run up the fees so that the individual really gets no growth at all. So I just wondered what's the experience been in those other states?
Yeah, well, I know, Dick, we've seen a lot of success in other states, and that's one of the slides that I wanted to kind of illustrate just about how this kind of snapshot just around the country about how much assets folks have been able to accumulate since the implementation of the program. So you have over $1 billion in assets that folks have been able to save. You have 2 out of 3 folks that enroll into these programs stay enrolled. And so I think there's some really good data that supports the implementation of the program. I am unsure about what you mentioned about the fees. I think that's certainly something to consider, but I haven't heard of any fees like I think you see in the 401ks.
And I know those are the types of questions that certainly, if the legislature is going to move forward on this, that are going to come up. So I'm sure you guys will have answers to those things, but that will certainly come up as a question.
Yeah, certainly. And like I said, Chris is the focus, the guy who manages most of our advocacy work and have those deeper conversations around the intricacies of the actual legislation. And so, like I said, a lot of these questions, there are probably answers for them. I just don't have them, but I'm certainly willing to follow up with you all about it.
All right. Anybody else have a question? Are we good to go?
There is one in the chat that I'll answer
Okay.
about the specific amount that has to be entered into the program. I don't think there's a certain amount that is required for folks to deduct from their paychecks. I think on one of my slides you have an average of around like 5% that folks are putting in from each of their checks, but no required amount.
All righty, very good. Well, thank you. Well, it certainly provides a good option if this should go through for people to save. Of course, still a lot of nitty-gritty things that need to be ironed out, but the concept itself, is certainly one that would help a lot of folks. So thanks again, DeMarcus. Appreciate it. Okay, and our third issue we're talking today is about special assistance rates rebates. And if you don't know, special assistance is that fund or that program that pays for people who are in assisted living that don't have the adequate resources and income to cover their own way. And we have with us today Jeff Horton, and Jeff is Executive Director of the North Carolina Senior Living Association. And Jeff, I have shared screen so you can share your slides.
Okay,
Thanks
thank
again,
you.
DeMarcus.
Thank you. Let me get going here. Okay, can you see it?
There you go. We got you.
Okay. Trying to get it on slideshow. Okay, there. Good morning, everyone. Like Mary said, my name is Jeff Horton. I'm with the NC Senior Living Association. We represent a number of adult care homes in our state and family care homes. Probably the majority of our members, except residents that their room and board is paid for, is state and county special assistance. So something near and dear to our hearts. It affects the who can get into an adult care home and also the care and services that they get. So I'm going to give you a primer on it. And I also see we've got folks on Division of Aging and with the department on. So I've used a lot of your information from the department's website, my own knowledge base. Hopefully I won't give any false information. I think this is pretty solid. So first off, before I get into this, I just want to, I'm assuming everybody knows what adult care homes are. I should have had a slide that kind of explained it. But in North Carolina, when you hear the word assisted living actually is defined in statute as two different levels of care. One is called multi-unit assisted housing with services, which is not licensed by the state. And those can take care of folks, but they have to have arrangement with the home care agency to provide care by appointment. These folks usually live in apartments and that type of thing. It's a lower level of care. And then you've got the other type of assisted living is adult care homes. And within adult care homes, there's two types of those. One is family care homes, which is 2 to 6 beds, usually in a residential home in your community. And then the other one is 7 beds and up. And those are what you think of. In the past, we called them rest homes. They started out as county homes back in the day, probably 60 years ago. Then they got licensed as rest homes, homes for the aging, and we call them adult care homes. So just to give you some scope, I just checked the website this morning for the state. There's currently 502 family care homes in our state. That's down from probably 600 that we had about 7-8 years ago. So they're declining. And then we have 576 adult care homes, 7 beds and up, and that's declined over the past number of years. So there's the kind of the background. So we're talking about state and county special assistance. So in the adult care home arena, whether you're 7 beds and up or family care home, we do have 2 tiers kind of care in this state. We have the private pay, which is not about this, and some private pay facilities, they can charge as much as they want, right? They can, many of those start out at $5,000 to $6,000 a month, depending on if you have a semi-private or private room. And I've heard prices as much as, $11,000 a month. And so they run the gamut in terms of what they can charge the private pay. Then there's the publicly funded assisted living or adult care homes. And that's where state and county special assistance comes into play. So state and county special assistance is for individuals with low income, eligible if they're 65 or older, and also between 18 and 65, and are disabled according to Social Security. All applicants must need a level of care as defined by the healthcare provider. They need a residential facility, but they can also desire to live and continue in their own homes. So I just need to mention, even though this is really more about facility-based SA, our state does have an in-home SA program. And basically what that means is if you meet all the requirements, you can get your monthly room and board payment, your SA payment, and use it to live in your own home or an independent living apartment or whatever. And also our association was instrumental a few years ago in making those amounts of money the same. In the past, the in-home SA program paid less per month than the facility-based that was an institutional bias, wasn't good. So we actually work to get that paired so it would be the same whether you're in a facility or in your own home or independent living. Anyway, and there's the other qualifications: U.S. citizen, income and asset eligibility, and be a resident of North Carolina. By the way, the residency requirements is, I believe it's 90 days. That's been an issue in the past because years ago, there were some states that would send, this happened in the 2000s actually, there were some states that would send their mentally ill people up here, let them stay here 3 or 4 months, and then they get on SA and then put them in an adult care home. So those days hopefully are behind us, but that has happened in the past. So the SA eligibility is determined by your local DSS, and a process of determining there were certain income level deductions for earned and unearned income. And typically they look at countable income, which includes, for the most part, Social Security, Supplemental Security Income, or SSI, and also VA, Veterans Administration income. Usually what we see, and I'll get to this in a bit, about what pushes people over the eligibility limit so they don't get SA and don't get Medicaid, is usually because of Social Security income. So hopefully I can get through this and you can understand it. If you're not, you can raise your hand and or ask a question. So the maximum SA payment an eligible individual can receive is tied to the maximum rate. Excuse me. I'm having a hard time seeing the screen. Maximum rate the adult care home can charge for room and board. So the state sets how much adult care homes can charge somebody that's on SA for their room every month. And so the current rate is $1,359 per month for basic SA, $1,743 per month for special care unit SA. The special care unit is basically memory care. And the reason the state allows more for that is because adult care homes that provide memory care services have to meet higher standards. Usually it's it can be an entire building can be memory care, or a wing or something like that can be. Typically they have more security features because you got folks with memory care disorders, more staff training and that type of thing, staffing ratios. So they get a higher SA amount. Also, folks get to keep $70 a month of their payment that they make toward a facility for, it's called a personal needs allowance, and they can use it for clothing, other essentials. That rate was $46 a few years ago, and Friends of Residents of Long-Term Care, Coalition on Aging, and our association advocated to increase that to $70 per month, and that's what it is now. So anyway, so when you add the 70 to what the facility can charge, that's called the maintenance amount, which is $14.29 for a regular adult care home bed and $18.13 for SCU care. And the maintenance amount is used for eligibility determination. So in other words, if your Social Security income, and let's say you just need a regular AO bed, you don't need special care unit, but your Social Security income is $1,500 a month, then you are over the eligibility amount, $14.29, and you can't get SA. And which you can say, well, they make $1,500 a month, they can just pay that for room and board. The problem is if the person needs personal care services, which is assistance with, bathing, eating, grooming, ambulation, assistance with medication, they can't get any kind of Medicaid services to help pay for that. Most of the time when folks get SA, which I'll mention later, you automatically become eligible for Medicaid. And Medicaid has a program called Personal Care Services that can provide care for those added assistance with activities of daily living that folks need. So here's an example. So John is 70 years old, and due to his current physical and medical condition, he and his family determined he needs to be cared for in an adult care home. His monthly income is $1,200 from Social Security. So for basic SA, his $1,200 is subtracted from the $1,429 maintenance amount for a distance of $229, which will be paid by a combination of state and county dollars. So since John's allowed to keep $70 a month for personal needs, the remaining $1,359 per month, which is $1,130 from John and $229 by the state and county, will be paid to the adult care home for room and board. And so when I say the $229 by state and county, that's an equal share. A few years back, the state did a review of the SA program. This was in 2016. And at that time, they found, for the most part, the SA, bundle rate every month. I think at the time it was $1,180, almost $1,200. That about 65% of that usually was from residents' income, and the other 35% was a state county share. So since John's eligible for SA, he's also now eligible for Medicaid, which can be used to pay for personal care services to assist him in making sure he receives medications, help with that ADL, such as bathing, dressing, mouth care, feeding, and ambulation. And just as a side note, so you're thinking, well, gosh, so what's the total amount a facility can get? So for basic SA and regular AL bed, the facility gets $1,359 per month, and they can get up to 80 hours of personal care services. That's usually the maximum that can be awarded to a resident in regular SA. And at the current rate that Medicaid is paying for 80 hours of PCS, it would be about $1,900. So you add that to the $1,359, and you get around, just shy of $3,300 a month total that a facility could get. Now, that's not saying all residents get 80 hours per month in regular SA. Just to get the Medicaid services is a long and sometimes painful process. Without going into a whole lot of detail, the state sends out nurses that through a contractor they use. They evaluate the resident, see what their needs are, determine, they have a calculation they use to figure out the hours, and you can get up to 80 hours a month. Now, sometimes they don't award 80 hours per month, but these days what we see that the folks that we're taking care of in adult care homes usually on average get 80 hours a month, because most folks have 5 or more ADLs that they need extensive assistance with. So we're taking care of fairly high acuity level folks, not nursing home level, but folks that need quite a bit of assistance. So the primary problem with the current SA program has to do with eligibility. As noted previously, the eligibility rate for regular AL bed, assisted living bed, or adult care home bed is $1,429 and $1,813 for SCU. Now, we did get a law passed in 2022 that says the SA rate is increased at the same amount of Social Security COLA every year. So it has been increased. It was $1,182 3 or 4 years ago. Then we got a COLA of 8.9%, I think, in 2023. And then we got a 3 point something last year. And this year we got a 2.5%. So it went from, 1182 up to current of 1429, and then also 1813, which helped. However, the problem is that rate, and I've got this on the third bullet, for 2008 to 2022, the SA eligibility rate remained flat with no increases from the legislature. So in 2008, the amount a facility could get every month that was paid to the facility was $1,182. And that was in effect until 2022. So you had the same amount of SA eligibility rate for 14 years. However, every year people were getting Social Security cost of living adjustments. And so what happened is, as a result, is we had a lot of people that weren't eligible for SA anymore. And you can see that in the numbers. I don't have them on the slide, but I can tell you in 2008, there was about 17,000 people in adult care homes that were receiving SA and Medicaid. And today we've got less than 10,000 receiving SA and Medicaid in adult care homes. And it's not because the service isn't needed. It's because that since folks got Social Security COLAs for a number of years, it pushed a lot of people over the eligibility limit for SA and Medicaid. So the other, excuse me, the other thing is, the second bullet here is something that we see and I hear about every month. Not a month goes by I don't hear about this from my members. So if an individual's countable income is even $1 over the SA eligibility rate of $14.29 for basic or $18.13 for memory care SCU, they are deprived from receiving any SA room and board payment. And more importantly, they're not eligible for Medicaid. The only exception is folks that are receiving SSI, which they're already eligible for Medicaid. And this also applies for individuals applying for in-home SA benefits. So you could be somebody, maybe you've got some, you think you can live independently, but you need help with your ADLs, you need assistance with bathing, whatever, you need a home care aide to come in to help you with that. However, you don't qualify for Medicaid. If you're not term disabled, you actually, and you are over the SA eligibility limit, you get nothing. You don't get more help for your room and board, and you're not eligible for Medicaid. So it goes for facilities and also for folks trying to live in their homes. The other thing, just to mention, is that the Social Security retirement benefit, as of December, I just checked, it was $18.34. That's the average for America, which means most people wouldn't qualify for basic SA or for memory care SA. But going back to what I hear from my members every month is I get calls from providers and they'll say, I had a family come in here today. They have a loved one that has Alzheimer's disease. They cannot manage this person at home. They're coming here. They need assisted living level of care. They need a memory care unit. And however, they're just a few dollars over the SA eligibility limit. So they don't qualify for SA. They don't qualify for Medicaid. So they get nothing. And again, Medicare, even though let's say they're 65 or older, Medicare doesn't pay for this level of care at all. So they're stuck. I mean, one of my members has a memory care facility. The whole facility's memory care. They turn away 2 to 3 people every month because these families come in there needing their services, and they're told, and they're like, well, sorry, you make just a few dollars over the SA eligibility limit, so therefore you get no help whatsoever. So it's a real problem that we're seeing. Also, this is a telling report, not to slight the department because they do the work on this, but it kind of tells you about how far behind the SA rate is. I mentioned previously that it was flat for 14 years. And so you say, well, what should it be? Okay, well, now that you ask, as required by law, every other year on the odd years, adult care home providers in the state, every adult care home provider that serves SA residents has to do a cost report that's audited by a CPA firm, and they have to submit it to the department. And the controller's office of the Department of Health and Human Services supposed to use it to adjust the adult care home rate at least every 2 years. I'm on the second bullet. An adjustment that is in addition to the annual standard adjustment for inflation as determined by the Office of State Budget Management. And rates for family care homes should be made based on market rate data. So every 2 years, and I get complaints from my members, they're like, I'm going to have to spend $3,000 to get this cost report audited to send to the state. And then the state does a calculation what it really costs for us to provide room and board care. But my members complain about it because they said nothing ever happens with this. We spend all this money. We go through this exercise. We send our cost reports to the state. They do this analysis to show what our SA rate should be. But then the state doesn't do anything to increase that rate. So anyway, according to the latest DHHS report, was just issued in August of last year, and this is based on adult care home audited cost reports, The basic SA rate should be $17.80 per month. And the memory care unit, or SCU rate, should be $2,067 per month. So if you compare that to what we're getting, so the basic rate should be $17.80 per month. That means we're underwater $350 per month per resident in an adult care home for regular adult care home bed. And then for memory care on the second bullet, we're underwater $250 per month, $254 per month. So if you want to know why family care homes have gone down from 600 to 500, and adult care homes have gone down from over 600 to now 576, it's because many of them cannot make ends meet. And they tell me this. They'll say, now, if you're in an area that you have some private pay residents, you can do some cost shifting. If you got enough private pay, you can use that money to help cover the losses of serving SA and Medicaid beneficiaries. But if you're not, if you have mostly SA and Medicaid in your adult care home, it's very tough to stay in business. And the main reason is in the third bullet, and everybody's seen this just in the past few years, is due to inflation, the cost of food, supplies, staffing have increased dramatically. I've had providers tell me that if they compare their food costs, for example, prior to the pandemic versus now, it's about a 30 to 40% increase in food of what they're paying. And even though SA has been increased some because of the cost of living adjustments, it's not enough to cover the losses. Also, staffing, since the pandemic, staffing, it's been very challenging to get folks, and they're having to pay higher wages. And again, most of our members, most every adult care home state actually is competing with, in terms of staffing, they're competing with hospitals, they're competing with nursing homes, they're competing with retail outlets. Amazon pays more than most direct care workers are going to get in an adult care home. So also for those folks receiving in-home SA, it's going to be more difficult for those folks to pay for rent, utilities, food, and other items with the current SA rate. So going to my final argument is SA, we believe, needs to be rebased to reflect what the department says it actually costs to provide care, which is again based on cost reports. And we would recommend doing it over a 2-year period. The pill would be a little easier to swallow if it was done that way, and just do half the difference in the rate from the regular SA rate. Right now we're underwater $350 a month, so do $175 this year, $175 next year, and then for the memory care rate, we would do $127 this year and $127 next year. After the rebase has occurred going forward, since SA will continue to be increased based on the annual Social Security COLA amount, the rate should better reflect the cost of providing care and services to residents. So there you go. I know it's a bit complicated. It's the world we live in here at the NC Senior Living Association and the members we serve. And I'm willing to take any questions if anybody has any.
Jeff, this is the BJ here. That puts a lot of understanding for me behind some other things that I'm part of the Friends of Residents Board and all. I'm so sad. Just want to say, question is the reports that are, put to the state on this particular matter, available for the public to kind of get familiar with?
You mean the report that the controller's office does?
Well, I guess so, and or the reports that each home or environment puts forward regarding SA in particular.
You mean the cost report data?
Yes.
Yeah, the audited cost reports are sent to the controller's office at HHS and then they pick they basically do a sample. They do a
Okay.
sample of about a dozen or so facilities. And then that's how they do now I haven't seen can you get the cost reports?
Yeah.
You probably can make a public records request. I don't have those.
Okay.
Usually what I get is I get the letter, the report from the controller's office that shows, based on our cost report studies, this is what the rate should be for basic SA and for memory care SA. I can provide that to you.
Okay, yeah, I'd love to, if it's on the website or whatever, wherever it sits, just send me the link. I'd love to get familiar with that.
Yeah, I can send that to Mary, and
Okay.
Mary can perhaps send it to the group.
Okay. And given that it's not lawful, that the state is not following their own, laws, has anybody taken up the cause on behalf of this in terms of suing the state?
I mean, it's been discussed. We typically have, but it's been discussed, but we've never taken that action. I'll just leave it at that. The other thing is for the department, it would be nice if the governor, for example, put this in his budget. Okay.
Mhm.
I've been in this position almost 8 years. I've talked to the department every year. Now I have the folks at Division of Aging, they have listened because they help administrate this program or have in the past. They get it, and they may go to the department, but usually by the time the governor's budget comes out, it's not there. The other thing is you have to have cooperation in General Assembly, and there's some legislators that are pretty tough to convince that it needs to be changed. Some of them have helped out some over the years, but it's been difficult. So I mean, just to put it in context, I mentioned earlier the state and county share is about 35% of the total SA payment. So when the state was paying, the state and county share was $160 million back in the early 2000s, 2012, 13, 14. Over the years since the eligibility rate has remained the same and more folks are ineligible, that means less people are being served and the state's paying less money. So the state's SA budget was 160 million back in the early 2000s. Now it's like less than 100 million. So the state saved about $70 million by keeping the eligibility rate low. And and you would think I would put the money back into it because people really need this service, but it's been usually when there was a savings, usually folks look at that and say, oh boy, savings it's not being used as much. It's not because it's not needed, it's just because fewer people are eligible. And then that money's usually reappropriated for something else. And that's typically what we've seen over the years.
So I'll
What do
say one thing. This is on the coalition's agenda. We believe that there should be a robust continuum of care in North Carolina, from all the way from services in the home and community to assisted living to skilled nursing care, and that people should have access to services regardless of their ability to pay. What we basically are seeing in North Carolina right now is that people who need assisted living are, because the rates have not been adjusted in 14 years, are finding it more difficult to access assisted living if they need assistance in paying for their care, because the rates are so low. The rates, and therefore they are not only not able to go into a facility as a special assistance resident, they also cannot take advantage of being eligible for Medicaid. So you've got people that are kind of falling through the cracks that we used to serve that we aren't serving now. And this is going to become a bigger problem as our older adult population continues to increase. And we know that the largest growing segment of the older adult population is the 85 plus, who are more likely to need assisted living and skilled nursing. So we basically have an issue of, we have a service delivery access issue for people that are falling through the cracks because of this. And that's the reason it's on the agenda.
Yeah, gotcha. Are we keeping tabs or information on those that come to the various organizations and are have to be turned away? Do we follow that data, I guess?
Yeah, that would be the DSSs.
Mhm.
I've seen some data where they've captured, but it's done. You know, we got how many 90 DSSs or more in the state, and so it's tough data to find.
Mm. Thank you
I
very
mean,
much.
the DSSs will tell you, and I've had DSS to tell me that they have folks come to them and they're just a little bit over the eligibility limit. These families are bewildered, or they come to our one of our adult care home members, and you know, so you're thinking, where are these people at? You know, well, some of them are in the communities, some of them's families are just hunkering down. Uh, some of them eventually need nursing home care. Nursing home eligibility is a little easier to get into. It's easier to get into a nursing home if you need care versus an adult care home. So there's a little bit of institutional bias there toward nursing homes. So it's very tough.
Okay, I'm going to move us on. BJ, thank you for your questions. Dick and Gloria, I see your hands up. So we're going to take about 2 more minutes for quick questions, and then we will move on. And Jeff, put your contact information in the chat so people can follow up with you if there are
Okay.
continuing questions that we aren't able to get to today. So Dick, I'll call on you. See your
Oh,
hand first.
Okay, Jeff, thanks so much for your talk. That's the first time I've had a prayer of understanding that whole situation. And so I just want to say that this is a crying need for the state when we have so many older people and the old people are gathering. And I'm just, I would encourage all of the advocates this year to really stress the human element of this. When people can't find a nursing home bed, when people can't find an adult care home bed, the family ends up taking care of the person, and it's an enormous burden on them. So this whole presentation ought to be human interest stories saying, who's going to take care of mom? Because there's enough people out there saying, I can't take care of mom. I have to work. You need to help me. Well, the legislators need to hear that to change their priorities. You need to put a human face on it because you've got a compelling case. So I just want to
Yep.
commend you for that and do a little cheerleading here.
Thank you.
Okay, Gloria, last question.
Yeah, sorry for all the questions, but this was just so depressing in a way to hear all of this. But what came to mind, Jeff, is there any way to track the number of individuals maybe who are like assisted care living level that, or even adult care home, that are not able to find access to care, that are now coming into the homeless shelters? Because we know across the state the number of seniors entering homeless shelters is on the rise as well, and obviously these people are falling through the cracks. So is there any way that that can be tracked?
That one, I don't think so. I mean, I don't know how to track that. I mean, there is one thing I'll mention about adult care homes, and I know some of the folks in homeless shelters, not all of them, some of them suffer from mental illness or behavioral health disorders. The state really had a problem with folks being mentally ill people being put in adult care homes years ago, and they got sued by the U.S. Department of Justice. And so the state really does not, if you're talking about homeless people but with behavioral health disorders, those folks, for the most part, shouldn't be in adult care homes at all. So if you got folks that don't have behavioral health disorders, as long as they have some disabilities that would require them to have that level of care, and their income is below the eligibility limit, they should be able to get in to an adult care home. Unfortunately, what we do see is, you know, I have had a couple of members have told me this, that they get calls from the hospitals a lot in the ERs, and they have these adults with mental illness, and they'll say, please take this person. You know, we don't have any place to put them. And the home says, you know, we're really not supposed to take those people anymore, and we don't. And so that's what happens to those folks. They end up in ERs. They can't find care for them. I think some of those folks end up in homeless shelters.
Well, Jeff, thank you. I think
you.
that everybody on this call has a better understanding of the issue, and And your slides were great, your examples were great, and I think put a face on the issue for folks
Right.
to understand this. So this
Thank
is
you.
one of the priorities of the coalition this session, and we will be working on that. So
Thank
thanks
you.
to all three speakers. You know, we feel it's important and we're going to put something on our agenda. Our members need to have good information about what's going on and why we have things there. So thanks a lot. So we are a bit behind time, but I think we're going to be able to make up here. Quickly, I'll just go through a couple of things as far as updates from the coalition. Our new executive director is coming on in a week and a half. Sandra Horton will be on February 3rd. So we'll certainly make plans to get her oriented to things and to begin to meet you folks once she's on board. The multi-sector plan on aging is gearing up. There are going to be implementation groups that are going to be formed around the recommendations that are in the plan. And a lot of coalition members are helping to lead up these efforts. Thank you guys for volunteering to help to be a part of putting meat on the bones of these recommendations. And if you're interested in being involved, there are ways that you can certainly join these work groups. The Hurricane Helene Fund that we're a part of with the North Carolina Association on Aging and the North Carolina Association of Area Agencies on Aging, we're meeting next week to talk about the distribution of those funds to individuals. And quite frankly, I don't know what the total amount is right now of that, but we'll have a full report on that at the next meeting. Legislature is back in session on the 29th of this month. Some new faces. Both the House and Senate have come out with who their leadership of their committees are going to be. A lot of familiar faces, but some new faces also of folks that we're going to need to get to know in order to advocate for our issues. I will say that Teresa Matula, who has been the longtime person in legislative research, that has been the person with aging knowledge, is retiring at the end of this month. I went to a retirement party for her last Friday, and she told me that they are not. She was kind of not only like the aging person, but she was also kind of the head of a lot of the research efforts in the General Assembly. And she told me that because of the timing of her retirement, they aren't going to fill her position right now with people that are going to be working on specific areas, but it's going to be kind of the existing staff is going to be working on all the issues, particularly she was working on as a staff person. So we may have some education to do with new people coming on board as far as legislative analysts are concerned. But Teresa's going to leave big shoes to fill and has been a great friend of aging communities for many years. We're going to meet Public Policy Committee folks will get together on Monday to talk about an advocacy day for aging groups in the state like we had last year. If you have any thoughts on that, Kay Castillo is our chair for that. She's on, so just drop her an email, let her know. If you know there are dates that we need to stay away from, that we don't need to be holding an advocacy day on because there's something else big going on in the state that day, let us know that too. We have been busy trying to get to know all the new actors in the game since the election took place. We have sent letters to the new governor, Josh Stein, as well as the new Secretary of Health and Human Services. And we have invited the secretary to actually come to our next coalition meeting or to one of our future coalition meetings. So hopefully we will get some positive response from that. I will say that Secretary Kinsley supposedly, has had lots of conversations with the new secretary, and that he publicly has said that he told him of priorities that he needed to pay attention to in going forward, and that aging was the first item on his list. So, well, we hope that bodes well for future efforts there. It is time for paying dues. I had somebody ask me the other day, says, why should I pay dues? I already get all your stuff and I attend your meetings, but I'm not a member. And I said, well, those dues help us to do all the things that you take advantage of, include the newsletter and our meetings and other things that we're engaged in. And we hope that everybody will consider paying your dues. You're going to be getting your newsletter probably going out on Monday. And there's a big soppy thing in there from me about why you should pay your dues. So anyway, just for what it's worth, I got my cup out waiting for dues payments. We've been doing lots of presentations to groups the first of the year. Everybody's getting back on their schedule of doing meetings and things like that. So it's been a busy time for us. I also saw Jill Zimmerman Lawrence on there, who's Deputy Director of the division. Jill, I don't know if there's anything you want to do as far as an update from the division or not. We used to have the division on the agenda to give a regular update, but if there's anything pressing that you want to make sure people are aware of, we'll give you that opportunity to share that too. If she's still on, she may have had to drop off. Okay, looks like she has dropped off. Okay. All righty. So with that, I'm gonna turn it over to Trish Farnham, who is our project coordinator for our Direct Care Worker Initiative. So Trish, all yours.
Hi, everybody. Thank you for such a wonderful meeting. And it was so good to get so many good updates on really important initiatives beyond the direct care workforce. So thank you all for those. I'm going to make my update very, very quick, but really focus on one thing. In addition to all of the really important collaboration that we are doing with the Center on Workforce for Health that Andy alluded to earlier, and that many of you all are part of, and frankly informing and leading, your subject matter expertise is leading the direction the coalition takes on all of our partnership work with the Center on Workforce for Health. I wanted to also elevate an initiative that perhaps is not as well known, and that is the pilot that our We Care initiative will be launching very soon. And I'm going to put some some links in the chat about it. But at a very high level, the We Care project is recruiting 50 direct care workers. Obviously, most of the time, direct care workers work for agencies, and so we're really reaching out to our agency partners in all sectors. So our home and community sector, our adult care home sector, assisted living sector, really focusing on identifying 50 direct care workers, direct support professionals in our IDD communities. To participate in a multi-month pilot that will focus on really how to build quality partnerships and relationships with family caregivers. So this is a really, really relevant topic for all of us, as you all can appreciate. And our partners at PHI have developed a training set of modules that really work to give direct care workers some really good insights and perhaps techniques for building that relationship, which can also often be occurs in sometimes very stressful circumstances and can be challenging to navigate at times. So we are really inviting people to consider that and to release it to their membership. For those associations who are on the call, please consider releasing the announcement to your membership. I'm going to put a couple of links in the chat, but if you didn't get the email directly from our Duke colleagues, email me offline because I'll send you the whole package. The deadlines are coming up quickly. We are working to get this cohort identified by mid-February, so February 14th. It will be several months of participation. Members will be compensated for their participation. And then we also want to recognize a piece of this work that's really exciting, that it's not just about going through an online training, which will be helpful and important, but it's also about developing a community of practice where direct care workers from across the different sectors can come together and talk about the dynamics they experience and perhaps examples that they can give, and they can together work through strategies that could support individuals who are providing the direct care work to feel more prepared for some of the family dynamics that inevitably arise in these kind of arrangements. So anyway, really excited about this. When I stop talking, I'm going to put a link to our overview presentation and also a link to the interest survey so that you can have that for direct care workers specifically. Again, I'll also put my email in the chat. So if you would like the bigger package that includes information to provide to providers and people in your network, please email me and I'll absolutely forward that if you haven't already received it. Okay. Thanks, Mary. I'm finished.
Okay. Any questions for either Trish or me on anything coalition related? Okay, thanks, Trish. All righty. Let's see, Daryl and Rosalie, any report from the Health Equity Committee?
Yeah, just briefly, and I echo Trish regarding the information received today in this meeting. Our last Health Equity Committee committee met on January 10th, and we received an excellent presentation by Lindsay Golden, who is a director with the Alzheimer's Association, as well as a co-chair of the BIPOC committee with the Health Equity Committee. And she does work around dementia and health equity. And it was just an awesome presentation, giving us a lot of data and information about the relationship between dementia and all of the BIPOC groups, particularly in North Carolina and across the country, actually. So please take a look at that. It is posted on the website, and you can hear the recording, I believe, and see the PowerPoint as she presented that. It was great. Also, beware and be on the lookout for information regarding a new survey for the LGBTQ plus group. And so that will be coming out soon. In light of the fact that DEI is being attacked everywhere and from all directions, the fact that we have issues that regard health equity are still very prevalent in our communities. So we will continue to move ahead until otherwise directed. And we appreciate the coalition really supporting everything around equity. And so that's about it. Our next committee meeting, the full one, is March 14th at 10 a.m. So while I have the group on the screen, NCRGEA has changed its name to something that we can remember, and it's RGEA. You see my new background, and we are now Retired Government Employees Association. So just want to let y'all know that we now have a shorter name, and we're excited about it with new colors, etc., more modern look. And we appreciate the time, Mary. So I just had to throw that in.
Thank you. Y'all
all.
have been rebranded.
Yes, we have. It launched last night.
Okay, great. And thank you to the committee for all that you guys are doing. And that was a good presentation by Lindsay at the last meeting. And that meeting and her slides and things are on the coalition website already posted. So thank y'all. All righty. So this is time of the meeting where we've got things to share. What you guys got going on you wanted to let folks know about. I see Brian Simpson with Social Security. Brian, tell us what you got.
Hey, Mary. Hey, everyone. Just now posted 3 quick links in the chat there for you. One is a webpage that we have now for updates about the Social Security Fairness Act, which you may have seen in the news, which was signed into law on January 5th. So you can find updates as we receive them on that first link. The second is a link about Identity Theft Awareness Week, which is from January 27th through 31st. And on that link, you can find information on a free webinar that the Social Security Administration is doing with the Federal Trade Commission, the FTC, on Thursday, January 30th at noon, if you want to join that. And the last is the January Social Security Update newsletter. So it's got reminders about Medicare Part B and the general enrollment period and several other items there. Thank you.
All right, thank you. I think I saw Lisa on earlier too, so thank both of you. Okay, Carol Kelly. Oops, looks like she's having.
There, okay. Can you hear me? Can you hear me?
Yes.
Okay, good. Yeah,
Yep.
I was saying my mind is still back to thinking of older adults in homeless shelters, which is just mind-boggling. You know, we have so many things to address. I wanted to share a book that I've recently started reading. It's phenomenal. It's, you know, we're all here because we care about older adults. It's called Aging of the Oppressed. It takes an international perspective of ways that older adults' rights are violated. So many of the issues that we talk about, LGBT, people with dementia, nursing homes, but it's just fascinating. It talks about solutions and things that happen worldwide that we're dealing with, rights of older adults. So I would recommend it. It's by Sylvia Perel Levin. Again, Aging of the Oppressed. Mary, if you're interested, I'll send you a copy.
Okay,
anyhow,
great.
So take a look at that. And soon I want to send something out about the looking at the dates, North Carolina Guardianship Association, we have a phenomenal conference planned, the 23rd through 25th of April, a lot of topics that are of interest to people. One is that healthcare pipeline to guardianship. We talked about going to ERs or hospitals. People don't know what to do. They apply for guardianship because someone is maybe has health issues. Later they get resolved, but it's really hard to get out of a guardianship. This is a national issue. And we're having someone come in and talk about that and alternatives to that, alternatives for older adults. Also a workshop on dealing with anger. If any of you have clients or deal with angry situations, this lady is phenomenal, and how you can get people to work together and diffuse those situations and work effectively. But I'll send out something more on that, Carolina Beach. So hope to see some of you there. Thanks.
Thank you. Carol, I have a question. So there was guardianship legislation last year to make needed changes to the guardianship law. And are there going to be more changes this year that are going to be sought by the General Assembly?
We are looking at changes, maybe not this year. We're looking at things about the role of the guardian ad litem. Right now, that's sort of a conflict with, that people have a right to an attorney. Also looking at changes in language. We use some really outdated language that we hope to see that changed in statutes. That is being worked on, but it's going to be a little while before we hope that we see those. And I'll certainly keep you posted of those.
Thank you. Yeah, we didn't put it on the agenda because we weren't sure what was going to be happening.
Yeah, that's not happening yet, but it's being worked on. But we will have sessions that deal with some of that.
Great, thank you. Vicki, I see your hand.
Yes. So Carol, you mentioned books, and hopefully people will find this one of interest. I actually where is it? Just wrote it. It came out in December. I'm a retired physical therapist. I've also got collaborators on it. The book is titled Aging Safely, Wisely, and Well, a Movement and Mindset Guide for Older Adults. My hope is that people will be interested in getting the book, both for themselves, their own well-being, as well as for the people they serve. I'm particularly interested in training healthcare workers in how to work with the older adult population. So my website is thera-fitness.com. That's T as in Thomas, like therapy, fitness.com. And you can learn more about me and the book. And I really just would love opportunities to serve the people here and the people they serve. So thank you.
Vicki, put your email address in the chat.
Oh,
if you haven't done it already.
Okay.
Okay, Janice Tyler. Thank you, Janice.
Good morning, everybody. Just a reminder, the North Carolina Association on Aging Conference is February 25th and 26th in Chapel Hill at the Carolina Inn. Please register now. We hope to see you in Chapel Hill, February 25th and 26th.
There's also an aging boot camp the afternoon of the 24th, right?
Right, and that will be, we're hosting it here at the Seymour Center. So if you've got new folks in the Aging Network, want to learn about how things work in North Carolina, that is the day before. Come see us.
All righty. All right, I don't see any other hands. Am I missing anybody? Up, got Janice. I don't see. Anybody else have anything for the good of the cause you want to share? Okay, well, thank you guys for a good discussion, good meeting today. Lots of information shared. It's gonna be a busy time, so put on your seatbelts, and we're ready to gear up here. So,
Mary?
Yes.
This is Sandra Phelps, the incoming executive director. I have a lot to learn about the Zoom. I was trying to find the hand raiser, and I figured, well, my voice is louder than my hand, so I'll just speak up. I just want to say, great meeting. I'm looking forward to meeting everybody in person and leaning into the experience that everybody has in the aging arena, and just looking forward to advocating for everybody.
Thank you. Well, good to see you. Y'all are gonna like Sandra. She's like the salt of the earth.
Thank you.
And we can't wait for her to get on board. All righty, guys, it is 12, it's 12, so it's time to go. So thank you very much for a good meeting. We will catch you next time. Look for your newsletter in your inboxes on Monday. Take care. Bye-bye.
Thanks, Mary.